Hello, my name is Allison Pridham. I'm the marketing representative for Dynamics Healthcare. Our respiratory therapist will work in conjunction with physicians and nutritionists to tailor a regimen that best suits each individual patient. Our company offers not only quality home health care, but also aggressive chest therapy for patients with cystic fibrosis. The purpose of this video is to emphasize the advantages of aggressive therapy versus conventional therapy or other apparatuses used for patients with cystic fibrosis. We have a passion for what we do, and that is to ensure a better quality of life for our patients. As healthcare providers, we all have a common goal that we can agree on. Until there's a cure, we will all do our part in helping our patients live a better quality of life. We look forward to working with you in slowing down the progression of cystic fibrosis.
Hi, my name is Nick. I get an aggressive therapy 2 times a day, one in the morning and one at night after school.
Hi, my name is Pam. I have a daughter who's 13 years old now, and she has cystic fibrosis. She was diagnosed at 3 months old, and we were lucky enough to get aggressive therapies starting at a very young age.
It all started when I was a little girl. I got aggressive therapies once a day because I didn't need it twice a day then. And I had little to no complications. I was very healthy and it was great. But then we decided to move when I was about 7 years old because we figured now we're all of a sudden healthy and we don't need anything anymore.
And then we moved away that's when she was 7 years old. And then we went to the doctor, and the CF clinic recommended that we use the vest, that the vest works just as well, studies show. So we did the vest for 3 years, and she, just went downhill from there.
I play tennis, I do skateboarding, skate at a skate park, and I do tennis matches. My FEV1 level is 90. I know that I've been getting good therapies because I do not cough during the night. But while I do these therapies, I cough up a lot of plugs and mucus to get that out of my lungs. And I'm healthy from that, and I can breathe a lot easier.
So we decided that the vest wasn't really working. It wasn't making her cough at all, and she didn't really get very much up. So we decided to get therapies again, and the CF clinic recommended some therapists, so we were excited. But the therapies were not the aggressive therapies that we were getting before. They hit very lightly. They didn't do the Trendelenburg or the segmental breathing, blows and coughs, which were very important. And they just weren't doing very well, and she got very sick and started to lose a lot of weight and was very lethargic, coughed all through school, tons of tissues in the morning when I went to wake her up on her bedside. So, we went to the doctor, and she got admitted. She was 66 pounds with severe bronchiectasis everywhere.
Once I got out of the hospital, we contacted some people and we are now getting 2 therapies a day, and I feel so much healthier. Before, I could barely even exercise for more than 5 minutes without even collapsing. And now I can exercise for, at least 30 minutes, and I'm fine. I drink a lot of water, I do a lot of exercise, and I'm not even on a high-calorie diet, and I'm still gaining weight, and I'm still at my normal weight.
An aggressive therapy makes such a huge difference in the overall health of my daughter. Now that she's getting aggressive therapy, she just doesn't even cough anymore. I just wish that they would be a little bit more educated in the importance of aggressive therapy and what a difference it makes. It makes all the difference in the world. Not all therapies are created equal.
It's such a difference. It's not even funny what a difference it is. And you would be absurd not to switch to the aggressive therapies.
As healthcare providers, we all have a common goal that we can agree on. Until there's a cure, we will all do our part in helping our patients live a better quality of life. We look forward to working with you in slowing down the progression of cystic fibrosis.